in 1974 and had signed my first teaching contract at a K-12 school district in Thomaston, Maine. I was teaching physical education, health, and I also coached 4 sports during the school year. I absolutely loved what I was doing, and I had a wonderful first-year teaching experience. As the next school year started, that was about to change drastically. During basketball tryouts in November, while running laps with my girls, I fainted. After going from doctor to doctor, searching for answers, I was sent to a cardiologist at Eastern Maine Medical Center. On May 5th, 1976, I began my real race with pulmonary hypertension, and essentially, over the next 22 years, EMMC would become my second home. May 5th was the day I had my first heart cath. I find it absolutely amazing that World PH Day is May 5th. I was extremely lucky to have been sent to a cardiologist who knew that I needed a heart cath to determine that I had PH, and I am truly thankful to him for that. The news he gave me was very disheartening. You have maybe 2 years to live. The time you have left will be very gloomy. He also said to me, there is no treatment and there is nothing else I can do for you. And fortunately for me, he left the practice. Who would be able to help me? Dr. Joe Wise took over my case. He told me as long as I wanted to keep trying, he would do everything he could to help me survive. Which turn should I make? Confusion, fear? Where do I go, and what should I do? Shortly after our engagement, David and I learned of my prognosis. I doubted myself as a woman and future wife. My whole world had been turned upside down. I wasn't dealing very well with my situation. How was I going to adapt to becoming David's wife? How could I handle a marriage when I couldn't even handle myself? Was this fair to him? David never considered not marrying me. This tells a lot about the person he is and has been during this whole journey. It has not been just my journey. It is, it was, and it will be our journey. June 25th, 1976 was our beautiful evening wedding. We spent the summer in my hometown in a camper on a piece of my brother's land overlooking a beautiful stream in the woods, of course in Maine. I spent a lot of time sitting by a campfire, pondering, writing, and trying to figure out what I should do with the time I had left. I did a lot of reading, and Kubler-Ross's book entitled Death and Dying was very helpful in my efforts to understand and deal with the prognosis I had been given. The realms of emotions from day to day were so varied: anger, sadness, relief to know that this was not all in my head, confusion, withdrawal, wanting to talk but just not able to. Was this really happening to me? I was good at shutting people out, but not very good about letting anyone in. 1 week after I was married, I was back in the hospital for a tubal ligation, as I would have never been able to survive a pregnancy. This was very difficult because I had always planned and looked forward to the time that I would be a mom. David and I would not be able to have children. It was devastating for both of us. How could I have gotten a disease that at that time only 1 in 2 million people had? I was able to find one article about PH. It was about a half-page long, echoed what I had been told, with the exception that once fainting begins, prognosis drops to 6 months. I had been fainting with very little exertion since November. I blindly went back to Thomaston to start the new school year. I was going through the motions of living, hiding from the reality of my situation. November arrived and I hit rock bottom. I took an overdose of my heart medication. I was nervous, scared, upset, and embarrassed. But at the same time, I remember thinking, maybe I can get some help to deal with this. Even during this devastating time, I had some hope. I was overwhelmed, and I did not know how to move ahead. Everything was all mixed up, like a big ball of yarn. I couldn't find the beginning, and the end just looked like darkness. I was afraid. You are 24 years old, and you are dying. One of the toughest times of this journey was the day I was admitted to the psychiatric floor at EMMC. Clinically, I was in denial about dying and depressed about my limitations. I learned a lot in my 2-week stay, including some skills for coping. It wasn't my fault that I got this disease. I hadn't been a bad person. I didn't have to blame anyone. This was the little flicker of light in the darkness that I had been looking for. I was able to write a letter to the disease, put it in a box, and place it on a shelf along with the anger. I chose to accept it and leave it abandoned. What a difference that made. A weight had been lifted. I was ready and able to move ahead and felt confident and better equipped to handle my life. It did not take long for me to figure out that if I was going to remain mobile, I would need some assistance. My physical limitations had become very apparent. Walk a few feet, lie down, try to relax enough to prevent fainting, and then try again. Dr. Wise suggested an electric wheelchair so that I would be able to be outside, go to events, and go for my walks. The only stipulation was that I would continue to try to exercise as best I could. After a bit of hesitation, I decided to swallow my pride of having to ride in a wheelchair and gave it a try. After the first few times, I became comfortable. I was able to go camping and get around independently. Dr. Wise consulted physicians all over the world in attempts to find something that might help me. Just to make sure he had not overlooked anything, I was admitted to Boston Children's Hospital under Dr. Nadis's care, who was a pediatric cardiologist. After many tests and a 3-week stay, I returned home on steroids and belladonna with no new information. In April 1979, I took an expected but undesirable turn for the worse. David and I thought this would be my last stay in any hospital, as I had started to faint while lying down. So we were preparing ourselves. Dr. Wise had just returned from a medical meeting, learned that a new anti-hypertension drug, nifedipine, had shown to reduce PA pressures in some patients, and a new catheter had been developed which could measure pulmonary artery pressure at the bedside. This article was authored by Dr. Wise based on his findings after I began Procardia. I returned home and started training, walking the distance between telephone poles, first 1 set, then 2 sets, until within a couple of weeks, I was walking a mile. I was able to return to teaching in 1981. Teaching physical education, however, proved to be too much for me, so I became certified to teach elementary education. I found the classroom perfect. I was doing what I loved, teaching and coaching. I was doing so well that after talking with Dr. Wise, David and I decided to pursue adoption. On April 30th, 1987, our 2 sons came home. Truly, a miracle is happening when you start an application in June for an overseas adoption, and 10 months later, you are a family of 4. Dr. Wise moved to New Mexico in 1987, and I must say, that was a very tough goodbye. I started seeing Dr. Silver, who I knew very well, and who had the same philosophy as Dr. Wise about my care. In the fall of 1996, I had pneumonia, which required hospitalization. I recovered, went home and worked, and in January, I got it again and recovered. After several visits and tests, Dr. Silver knew that nifedipine no longer had the effect that it had prior to the pneumonias. He told me he had been in touch with Dr. Robin Barst at Columbia Presbyterian Hospital in New York City. He was concerned about my increasing PH symptoms. In March 1997, I had a consult with Dr. Barst. There were many tests during this consult. I met for the first time another PH patient, 21 years after my diagnosis.
Oh my goodness.
Someone knew how I felt without my having to say anything. I didn't have to explain. I didn't realize how isolated I had been until talking with these patients. I learned about PHA and support groups. Even though the nearest support group was almost 3 hours away from my home, I would start attending as soon as possible. The toughest news of this visit was learning I would have to retire from teaching a second time. I did not want to have to go through this again, but I knew I had no choice. In April, I was admitted to Columbia Presbyterian. David, Ian, and I learned how to mix Flolan and all the what to do and how to do it. I had the catheter placed, and my life with Flolan began. I was nervous leaving the hospital, but I knew it was time to go home. It was a bit scary that only the three of us knew anything at all about Flolan and all the intricacies of using it. I had regular visits in New York twice a year. I was increasing Flolan on a regular basis and doing very well. March 1999 found me having lung surgery for a suspicious nodule in my lung, a mandatory pit stop of about 12 weeks. It was a relief to know the nodule was not